This is HealthCall Online, the place for extended versions of interviews you hear in our weekly radio broadcast, the HealthCall Radio Hour. You know, businesses around the country are soon to see what may be the biggest cost increase for health insurance in quite some time. A report in the Wall Street Journal quotes analysts as saying that we could see a healthcare cost increase of 7% or more in the year ahead. That's equal to about $1,000 per employee for each business. And that is already one of the biggest costs that many small businesses face. So this is driving growth of a new type of healthcare, something called direct primary care, a new model for businesses in which patients become members of a physician's practice, paying a flat rate for healthcare that covers many different services. How does this work, and what's ahead as this industry changes? Well, let's learn more about that by talking to Dr. Jarrod Wiegman, who operates Indiana Direct Primary Care, one of those businesses that offers what I like to call sort of the Netflix of medicine for small businesses. Dr. Wiegman, thanks for being here. Tell me about how this works. So you kind of become the company doctor for these businesses?
Yeah, essentially we become the primary care network for the businesses themselves. What we can provide, whether those companies have insurance or not, is, care in a primary care setting for their employees. And, I like to think it's better primary care than what you get in the bigger institutions because we are smaller. We are able to take, on the employees, but we take less patients in general. So we have more time to spend with them. And we are more responsive than a lot of the bigger institutions where you get an appointment in a week or week and a half. We can see people pretty much the same day, next day.
Yeah, and I think communication with the patients is key on all of that. We're going to talk about that in just a second. You are board certified in internal medicine and family medicine. I know you worked as a hospitalist in the past, so you're qualified and experienced in treating lots of chronic care conditions. How does that come to play for patients, and what benefit is that for businesses?
I think, most people that are trained in internal medicine or family medicine both are, trained well in chronic conditions. And training, you get a lot of extra time with patients. You're learning and you don't have as many patients. So it's, very similar to the timing that we have in direct primary care. So you're able to treat a lot more of those chronic conditions as you learn. When we get out in practice, then it becomes, corporate medicine, and you don't have that time with patients. You have 15 minutes, and to establish care with the patient and then, go over one chronic condition, let alone 3 or 4, becomes very difficult or almost impossible in that time frame. When you move to a direct primary care model and you have the time to spend with patients, that hour-long appointment, you have the follow-up appointments that don't cost the patients any more money. You have the ability to take care of these chronic conditions without having to refer off a lot of times. A lot of what primary care doctors do is refer off things that they just don't have time for, not that they don't have the knowledge to do.
Isn't that interesting? I don't think most people realize that. So what happens when you do have to refer off to a specialist? They're outside your envelope, so there's additional cost for the patient or the employer. How is that typically handled?
So obviously that depends on whether or not the employer has some underlying insurance. Most do, and if they have underlying insurance, then they'll have to go through their copays and deductibles and things like that in their plan. Those that don't, we try to find and partner with different groups of specialists to take on cash pay patients, and a lot of times they'll give them discounts for those services. There's also telemed services that they can get if it is something that's not required in the office. It's a cheaper option. And, above and beyond that, there are certain things that can't be covered, but, patients do need. There are a lot of different online resources and places that people can go to find cheaper options.
Yeah, that's interesting. Let's talk a little bit about that. Give me some examples of how you're bringing that to work for patients.
So a couple that we've used very recently, actually, oftentimes when people go to the doctor in big institutions, they refer you off to their own radiology department. And there's no choice to go other places. And in many cities, there are independent imaging places. And there are, you can directly go to those imaging places via a Google search in your town. Or there's a website called radiologyassist.com that radiology assist will put in a zip code. You actually can put in the study that your doctor has ordered for you, and it will actually give you the prices around the local area, and you can choose to fax your order into that particular place, and you have some options and choice there. The other thing that I've just recently learned about, actually, that I didn't even know about, one of my patients brought up to me, is a colonoscopyassist.com. So, colonoscopies and colon cancer has become a huge thing recently where, we're actually supposed to start screening earlier now. It was 50, now maybe it's 45. And if we're looking at options for colon screening, we have the Cologuard, the commercial where the little box dances on the TV. And then we've got the gold standard colonoscopy. Colonoscopy at major institutions or surgery centers can be $3,000 to $6,000 just for a screening colonoscopy. But my patient recently told me, and I looked into this colonoscopyassist.com. It wasn't inexpensive by any means, but it was only $1,200 for the same procedure. So there are certainly many other options and availabilities out there. It even goes as far as surgery centers. There's a surgery center here in Indiana that that has a direct primary care model. They take cash-based pricing for surgical procedures. It's a one-pay system. If you have to get your gallbladder removed, you go, what the price is up front. That price doesn't change. That you don't have to pay an anesthesia bill. You don't have to pay a surgery bill. You don't have to pay a facility fee. It's one price. So there are a lot of these options available out there that people aren't aware of, because a lot of times those big systems feed into the same big system without giving people options.
Yeah, you're captive within that network. That's interesting. I didn't realize all those cash pay independent services are out there. That's good to hear that market is growing. If my employer offers a health savings account or something of that nature, how does that touch all of these services?
So the health savings account can be used for a lot of different things. Depending on how the employer sets it up, that can even be used for direct primary care services. Oftentimes, employers and employer groups, join as one big group, so that they're paying, and you can use that or the monthly fee as a pre-tax dollar feature throughout the company. But if they offer just a health savings plan or health savings plan in addition to their high deductible health plan, those people can oftentimes use that health savings plan for a direct care membership. Again, it just depends on the direct care institution and the employer, how they set it up.
I think it's so interesting to see how healthcare is changing. What about prescription drugs? Do you play any role in helping patients save money there?
So we try to help our patients save money across the board wherever we can. When it comes to prescription drugs, a lot of times we look at the different pharmacies around town and which ones might be cheaper. And those sometimes include independent pharmacies around town, and there are still a few here in Fort Wayne. There may be some in other cities as well. When we look at those, I try to tell people, what that particular prescription is going to cost at the different pharmacies, and let them choose at that point. And sometimes they choose a little bit higher cost, but it's more convenient. And sometimes, it's more beneficial for them to go to a different pharmacy, so we send it to different pharmacies. There are other options as well. We have a wholesale pharmaceutical company that will actually send me meds to my office that I can dispense in the office. And what I found is some of the more expensive meds that we can get at other pharmacies, I can get through them and actually still get cheaper for the patients, and they can just pick it up right at our office.
Oh, that's interesting. What about lab tests? That's such an important part of healthcare these days, those diagnostic screenings. How does that work in your office?
So most direct primary care practices partner with an outside lab. There are a few across the country. So the one that we use here is LabCorp. There's also Quest, and there's a few others. They've partnered with the direct primary care practices essentially as a group. So we get a group pricing, even though we're really individual practices. And when we look at that, it really is a huge savings for patients. When, after having worked with the hospital systems previously, looking at lab tests, including what would be your general panel that you would get for health physical, including blood counts and liver and kidney function and cholesterol and, diabetes test and a thyroid test is kind of the typical thing you'd get at a physical. If you were paid cash price for that, or the hospital's cash price for those tests, you'd be looking at probably $400 to $600 for those tests, which is crazy. When you do it through, our office, that whole panel is $30. And the one thing that you realize when you're on this side of medicine is, and the reason that those lab companies can do this, most of those labs are done with the same blood vial and the same machine. It just depends on what they report out. So they're not utilizing any more resources. They're just charging you more money.
So that just floors me. A $400 test for $30.
Yeah, it's pretty amazing. The upcharging, and a lot of that goes to the overhead that those facilities have. Direct primary care practices are literally doctors and patients, and we might have a front office staff, but we don't often have a lot of nursing. We don't often have a lot of billers. We don't have all those back end people that have to deal with insurance. So we're able to cut the overhead significantly.
Yeah, that's just remarkable. Patients, I'm sure, are a little. I think they might be a little hesitant to use you. Full disclosure, I am one of your patients. You and I met, and I introduced you to the audience as we were first exploring the idea of direct primary care, and I kind of liked the idea so much I jumped on board, and I've referred a couple of others to you, and one of them is kind of a complex case. Gentleman's had a kidney transplant, and he confided in me he's worried that he might be taking advantage of you and abusing you by reaching out with so many issues. Does that happen? Do patients get a little overboard sometimes?
I haven't seen that in my practice. I can't say it hasn't happened in other practices. What I really find is those patients that feel like they're being overwhelming to me, and they'll come out and tell me, I don't want to overwhelm you, and I'm sorry for texting you, or I'm sorry for calling you, I'm sorry for emailing. What I respond to them is this is the kind of care that you deserve. This is the kind of care that you should get, and you're not overdoing it. Most people feel bad for reaching out and getting an answer. They expect, and that's what people have come to expect in America, is that when they reach out, they may not hear back for 2 or 3 days. Mm-hmm. That is wrong. And to get a response within the same day, to feel bad about that, it, to me is, honestly, it's a little ridiculous to worry about that.
So I think people might be surprised. You just mentioned texting there. I can text you and get an answer. That's kind of a surprise.
Yeah, that's the world we live in now, though, right? Yeah, phone calls and messages and those things that, we're used to 10, 15 years ago have now become text messages. And those text messages sometimes are very simple. And so if you just have a quick question, to be able to text a doctor that to say, I need a refill on this medicine, it becomes much more simple because it doesn't have to go through a third party. It doesn't have to be, relayed to me in any form or fashion. If it's a text message, I can open it up and get to it when I have time. And so it works both ways. It works for both the patient and myself. And they also have access to email too. Sometimes text isn't, you can't have a conversation or a detailed, question and within a text. So email is also available to patients too.
Yeah, and let me share this little personal story. So, and you're free from all HIPAA requirements here, so don't worry about this. I have a little bump on my foot. I think you called it a synovial cyst. Okay, so that's just a little bit of synovial fluid from the joint that's come up and formed a little bubble. And I noticed that it was growing. And so I just snapped a couple of pictures with my cell phone and sent them off to you and said, hey, is this anything I need to be concerned about? And the answer came back within literally 15 minutes. Nah, no big deal. Unless it gets inflamed or painful, then let me know. And I've shared that story with other people, and they're shocked to think that they can send a picture to my doctor and get a response. Why can't that happen in a traditional doctor's office?
Well, it can, and they've tried to do it. A lot of different hospital organizations and bigger institutions have, instituted things like MyChart, or whatever it is in your state, that you have that online access to the doctor's offices where you can send them messages, you can send them pictures, and other things. The problem with the bigger system is, again, the overhead and the middle people that exist within that. So when that message goes through, it doesn't often go directly to the doctor. It goes a lot of times to a front office staff or a nurse. Well, the front office staff or nurse may be busy doing other things, so they may not get to it that day or the next day. when they do get to it and finally direct it off to the provider, the provider, again, may be busy and may not get to it for a day or two. So when you send that message, send that picture, send that question or refill request, all those things, they're delayed because of the process, not because it doesn't exist.
And I understand there's also some challenge around how do they bill for that? I just saw one big health network is now starting to charge for emails. So yeah, that whole billing issue comes back to bite us once again. I am also intrigued by the fact that you put so much focus on integrative care and really kind of getting to the core of the problem as a way to reduce costs. Let's talk about that for just a second. How does that work in your practice?
So when you talk about integrative care, there's true integrative medicine, and then there's what we do, which is a little bit of a combination. And I like to think of integrative care in the way we do it as really traditional medicine, the way it should be done. Okay. When we look at integrative care, we're talking about old school medicine in some ways. We're talking about looking at people's diet, their exercise, their weight, things about their daily routine that are causing them the problems in their life that they're having, and how we can adjust those not only for a healthier later life, but also those who already have medical problems who can affect treatment by changing some of those things. That in and of itself is, somewhat of integrative medicine these days, because it's not talked about regular doctor's offices anymore. There's just not time for it. It's when you go to a regular doctor's office, it's about, what kind of prescription medication can we prescribe for you? What kind of over-the-counter drug is necessary for what's going on? When we look at those features, including diet, exercise, weight, whatever we could do on that side, we have a lot of patients who are honestly either don't want to take prescription medicines or don't trust pharmaceutical companies now. And there's a lot of trust issues around medicine these days. So what we look for in those respects is, how can we do this in a more natural way? Are there natural products that we can, garner the same or at least partial treatment to get some improvement in these conditions? And a lot of times there are. The one thing that I really press upon the patients is not all supplements are created equal. Be careful what you buy out there. There's thousands of supplements. They're not rigorously tested, most of them. So the ones that we utilize in our practice usually have some rigorous testing. They have some actual study data behind them, and they're very what we call clean, which means it's the supplement you're getting. There's not a lot of sugar. There's not a lot of additives. There's not a lot of other things that people can react to. We want the supplement that's getting whatever process taken care of, not all the extra stuff.
Yeah, that makes sense. We started this conversation talking about direct primary care as an alternative for employer-provided healthcare. Let's wrap it up that way as well. Who's a good candidate for this? What type of business is really going to benefit the most from a relationship with direct primary care?
So a couple different varieties here. The small business that really can't afford to give health care to their employees from the full perspective, meaning they want to give them some ability to, see a doctor, but they can't afford to give them full insurance. As a small business owner myself, I 100% understand that. It's just too expensive when you talk about, the Wall Street Journal article with the, rates going up 6.8%, and that being $1,000 per year per employee. For $1,000 or less per year, you can give them an entire year of care in a direct care practice in most places. So that's their whole primary care for what most plans are going up next year when you look at that. So that's pretty impressive. The other thing too is, as those prices go up with those other plans, employers may look towards how can I save money? What can we do within our plans that we have existing now to, save money and make this more feasible for us? And a lot of times what that means is going to higher deductible plans or giving patients those health savings accounts, within those plans. And when you look at that, if they're able to go to those higher deductible plans, the problem is the vast majority of people don't have $5,000, $8,000 a year out of pocket if they need it for certain things. So what they can do is combine the direct primary care with their high deductible plan. So those patients have 100% coverage for their primary care needs and a lot of what you can do with what I consider, better care because we have more time and lots of other things that we just talked about. But they're able to combine those two and still save money.
Well, I think that's an important step toward making all of us healthier by addressing health needs and not letting the cost keep you away from seeing the doctor when that's necessary before things get out of hand. So I hope more businesses will at least investigate and find out about this. And I'll include some links to a national directory of direct primary care practices so you can find someone in your area if you're not in the area where you could be served by Dr. Jarrod Wiegman at Indiana Direct Primary Care. You'll find them online at indianadirectprimarycare.com. Jarrod, good to talk to you. Thank you.
Always good to talk to you. Have a great day.